Cancer treatment often comes with unfamiliar terms that can feel overwhelming. From diagnosis through treatment planning and follow-up care, patients and advocates hear specialized language related to how therapies work and why certain treatments are chosen. Understanding common cancer treatment terminology can help patients feel more informed, confident, and engaged in their care. First, we'll look at core treatment approaches. Surgery is a treatment that removes cancerous tissue from the body. Surgery may be used to cure cancer, reduce tumor size, relieve symptoms, or confirm a diagnosis. Chemotherapy is a treatment that uses drugs to kill or slow the growth of rapidly dividing cancer cells. Chemotherapy affects both cancer cells and some healthy cells, which can lead to side effects. Radiation therapy uses high-energy rays or particles to damage cancer cells and stop them from growing. Radiation may be used alone or combined with other treatments. Now, let's discuss targeted and immune-based treatments. Targeted therapy is a type of treatment designed to target specific genes, proteins, or pathways that drive cancer growth. Targeted therapies work best in cancers with certain molecular features identified through testing. Immunotherapy is a treatment that helps the body's immune system recognize and attack cancer cells. Immunotherapy includes several approaches, such as checkpoint inhibitors and cellular therapies. Checkpoint inhibitors are immunotherapy drugs that remove brakes on the immune system, allowing immune cells to better recognize and destroy cancer cells. Antibody-drug conjugates, also sometimes called ADCs, are a newer form of targeted therapy that combines an antibody with a chemotherapy drug. The antibody delivers the drug directly to cancer cells that carry a specific target, helping limit damage to healthy cells. Lastly, CAR T-cell therapy is a type of cellular immunotherapy in which a patient's own T-cells are collected, genetically modified to recognize cancer cells, and then returned to the body to attack the cancer. CAR T-cell therapy has shown remarkable results in some blood cancers. Let's move on to genetic and molecular terms. A genetic mutation is a change in DNA that can influence how cancer grows and responds to treatment. Some mutations can be targeted with specific therapies. Biomarkers are measurable biological features, such as a gene mutation or protein, that provide information about how a cancer behaves or how it may respond to treatment. Biomarker testing is testing performed on tumor tissue or blood, which is called a liquid biopsy, to identify genetic changes or proteins that can guide treatment selection. Let's pivot to words you may hear during treatment or monitoring of the disease. Your treatment regimen is a planned course of therapy that outlines the treatments used, doses, and schedule. Line of therapy refers to the order in which treatments are given. First-line therapy is the initial treatment. Later lines are used if the cancer does not respond or returns. Your doctor will determine which treatment is best to start with for your specific situation. Response to treatment describes how cancer changes during therapy, including complete response, partial response, stable disease, or progression. Resistance is the term to describe when cancer stops responding to a treatment that was once effective. Lastly, there are a few terms regarding supportive care. Prognosis is an estimate of how a cancer may behave over time and how a patient might respond to treatment. Prognosis is based on population data and individual factors, but it is not set in stone. New treatments, personal health differences, and individual responses can significantly alter outcomes. Palliative care is focused on managing symptoms, side effects, and quality of life. Palliative care can be provided at any stage of cancer and alongside active treatment. It is not the same as hospice care, which is for patients undergoing end-of-life treatment. Cancer care is complex, and understanding the language used helps patients and advocates ask informed questions and participate in shared decision-making. Clear knowledge of treatment terminology empowers patients to navigate their cancer journey with greater confidence and clarity.